And I have to say, it really shames me. It really shames me that so many doctors are unhealthy. You have no idea. So many doctors are not just poor diet, poor exercise, metabolic syndrome, addicted to benzos, alcohol, fatty liver disease. I mean, the doctors are really, sometimes you question, like, are these people really in the right place to impart medical advice? Like, is that really the case? I mean, most of them are stroking out at 65. Like, that's hardly an example of longevity and health. So,
and I, Dr. Abdullah, I blame managed care on it.
Of course.
How many patients would you get in your clinic if you were metabolically unhealthy? You would get almost zero. I mean, seriously, you wouldn't get that many.
Right.
But when you sign up with insurance companies and they send you business, you don't have to walk the walk and talk the talk. You don't have to. They're just going to come to you because the insurance company told them to come to you. And that's the problem.
Right. And Shawn, because they see 30 patients a day, the doctors themselves actually don't have time to read up, be current in the knowledge, and exercise, and cook and pre-cook their meals on a Sunday so that they can have a decent meal throughout the week. So managed care not only encourages low quality care and disincentivizes the doctor from becoming healthier, but it also causes the doctor to be unhealthier. Mm-hmm. So that's kind of what it does. But we must not forget the role that doctors themselves played in allowing managed care to do this to them. Mm-hmm. Because the thing is, I don't care what kind of doctor you are, if you're a surgeon, if you're in a non-procedural field, you have the option of not working for managed care.
That's right.
But you have to be willing to go through a few first years of hardship. You got to be frugal, and then to find freedom at the end. Freedom is expensive. But a lot of them are not willing to do that. They're not willing to make the sacrifices. So I'm like, you know what? Enjoy the workload, enjoy the metabolic syndrome, enjoy finding yourself completely useless in 15 years and replaced by a nurse practitioner. You go ahead.
You said it. Yeah. And I personally, I don't feel sorry for him.
No, I don't. Zero empathy. Yep, absolutely. Right.
Well, Shawn and I could probably say that the same for our profession, because it didn't take us long before we realized that patient wasn't just walking out with 5 medications. Pretty soon it was 10. And they didn't look better. They actually looked worse. And, the conversation I've had with clients is, you go into your vet with your pet, and the first thing we talk about is what nutritional and activity and their weight. We talk about the basics, right? Why are pets in the United States being treated better than humans?
I know. Right.
And I love animals, but there's just a big disconnect. And pharmacy plays a huge role in it. And our profession has sold their patients out by allowing them to have that many medications going out the door. And they're sicker and sicker and sicker. In the last 30 to 35 years, we have not improved American patients' outcomes or the health of our nation. No. We're at an all-time failure rate.
Yeah, we just increased the costs. That's all we did.